We're going to talk a little bit about the protocol going forwards for this horse. So we've made a pretty drastic change when you look at the physical outside of this horse's foot. But when you look at the radiographs, actual angles of the coffin bone, relation to joints and stuff have changed very little. So we actually haven't applied extra stress anywhere. We've just taken a bunch of extra stress away from where it shouldn't have been by the toe breakover being too far forward, the toe being long as well as some flare. So there's not going to be a lot of change right within this horse's leg, but because of getting the weight bearing underneath it, we've changed the way the horse stands. The horse's leg is now back farther underneath it. What will happen is the horse's top line will rise up, the tail will drop a wee bit, and their hind feet will move forward, and you'll have more of a together, collected type of a horse. Jeff has told us that she generally stands with her feet out in front of her and her back hollowed a little bit. So that's going to change over the next few days. So that's why you don't want to jump on this horse and go team penning tomorrow, because there's a whole lot of changes got to go on in this horse's, not only in his skeleton, but in all of his muscles. So I would give this horse free access to exercise and give her at least 2 or 3 days to adjust. If you notice any soreness, then you want to leave it longer. There may or may not be some soreness goes with this because we've made a big change, but don't get alarmed unless it's really severe and it lasts for more than a few days. So now we're going to talk to Dr. Ferguson, and she has some follow-up that she's going to do and talk about how we all work as a team, and it's not just one of us. It takes a team for this to work.
Yeah, so as veterinarians, we have medications that can help a horse, relieve some discomfort. But a biggest thing, it's kind of a band-aid for a problem. The biggest thing is having a really good qualified farrier who can do a really good job of setting the horse back where they need to be. In the meantime, if she does have days where she's kind of sore and uncomfortable, a little bit of bute will kind of help take the edge off and help her get feeling better. And then once she's kind of back into, had her little bit of rest, everything's kind of adjusted, you can stop the bute. But yeah, really the medications for us are kind of just a band-aid, just to cover up. You have to fix the underlying problem in order to, get them off the medications.
So Dr. Ferguson does have a medication that she's going to give this horse as the ongoing therapy to get this horse back and being competitive again. I'll let her explain that to you. And just to note that just because we do the feet right, we still need the veterinarians to do their job. But if you get a horse balanced, then their job works better. And if I get the veterinarian, or Horseshoe gets a veterinarian to help them, and you work as a team, the work that I do will work better if we all work together.
Yeah, so in Jiggles' particular case, she's going to get a medication called OSPOS, and that's to help with the navicular, the beginning of the navicular disease that she is developing. So what OSPOS does is there's 2 types of cells in the bones. There's osteoblasts, which build the bones, and osteoclasts, which kind of eat the bone away. They're both there in normal bone, and they're there for normal bone turnover. There's constantly osteoblasts building bone, and constantly have osteoclasts eating away in every single one of the bones of the body. So what the OSPOS does is it actually inhibits the osteoclasts, which are the cells that eat away at the bone. So by inhibiting the cells that eat away at the bone, it keeps the navicular bone from kind of getting eaten away more and more over time, which is how navicular disease kind of develops and progresses. So Jiggles will get some of that today. It usually lasts for about up to 6 months, and then kind of bute to help her on the really bad days. Another medication that we like to put horses on that have kind of chronic lameness problems, if we expect it to be a little bit more of an ongoing thing, is Previcox. It's another non-steroidal anti-inflammatory like bute, but tends to be a little bit easier on the digestive tract and the kidneys. There's other options we can also do in Jiggles' case because she wants to go on and have a cutting career. Probably this spring we will do coffin joint injections to kind of help, and possibly navicular bursa injections to kind of help ease her discomfort and really get her into competitive shape.
So we'll send Jeff home today, and so we have a few months to spring for all that we've done today to work. And then we can reevaluate in the spring as to how much more veterinarian work she may need, or if there's something we need to change with her shoeing. But and we'll be interesting to see a couple months' time. We'll talk to Jeff and we'll see what kind of progress we made. Thank you.